If you have sciatic pain, one of the coolest exercises I've ever seen that will help is an exercise called spinal flossing. So if you think about when you floss your teeth, you move that floss sort of back and forth in between your teeth to help get the gunk out. Spinal flossing is it's like moving the sciatic nerve in and around its, whatever its range of motion is to help free up some of the adhesions, some of the scar tissue, some of the inflammatory products that develop around it to help free it up and just make the whole thing feel better. So the spinal nerve, it passes through L2, 3, 4. It comes out L2, 3, 4, so your second, third, and fourth lumbar segments, and passes down through the pelvis and down the whole leg and into the foot. And it has a certain amount of give as you move. So as you move your spine, that nerve is kind of going to move up and down a little bit as you're moving. So when you think about the positions that are going to create more tension on the sciatic nerve, this, for example, is one of them. So if I bring my leg out and flex my toe, that's going to create tension on the spinal nerve. It's going to, I keep saying spinal nerve, the sciatic nerve. It's going to stretch it out. If I had my leg dropped, but I drop my neck down, that's also going to stretch the sciatic nerve. So if you think about the position that would have the most tension for your the biggest stretch for your sciatic nerve would be with your head dropped, your leg up, and your foot flexed. The one that would have the most relaxation for the sciatic nerve would be the opposite. So the foot bent like this and the head like this. So as we're going through these motions of spinal flossing, I want you to think about the nerve moving like this through its areas of tension and relaxation. Okay, so if you have intense sciatic pain, I want you to start with this one. It's the easiest. And then what you can do is you can try the different positions. And if you're able to do a position without pain, you move into the next position. If you're able to do that one without pain, you move into the next one. So the first position that you're going to try is with your head extended. So remember, that's going to relax the sciatic nerve. But then what you're going to do is you're going to bring your foot out and extend it. And then just bring them both back to neutral. Tilt your head, bring your foot out and do extension, flexion, and then back again. Okay? So do that 10 times. If you can do that without pain, then the next one that you can try is bringing your foot out like this, and at the same time extending your head up like this. And then as you bring it back, relax your foot, but bring your neck into flexion. So you can picture that nerve moving like this as I'm making these motions. Okay, so this one is out and head extended, in and neck flexed, out and head extended, and in and neck flexed. So do that 10 times. If you can do that without pain, then what you're going to try is the position that will put the most amount of stretch or the most amount of tension on that sciatic nerve, and that would be you bringing your foot out and flexed and your neck down and flexed at the same time, and then relaxing both and bringing them both down into flexion and relaxing them both. Flexion, relaxation. And as I said, as you do that, that sciatic nerve is going to be moving in and around where it's at, cleaning out some of the debris that's in and around it, freeing up some of the scar tissue that's there and forming, and it's just going to help take some of the pressure off the sciatic nerve. Do this in conjunction with some of the other exercises that I've prescribed for low back pain and for sciatica. And of course, make sure that you're seeing us in the office to correct the structural issue, because sciatic pain never happens without a structural shift that's happened in the spine. So our job is to correct the spinal shift. Your job is to help the supporting structures with the exercises that we give you at home. I hope that's been a big help for you.